To pick up where we left off, in a single phrase, an iPS cell is a rejuvenation stem cell. And as for the risk of them turning cancerous,
Personally, I feel we've largely overcome that.
alright, on to the next question. We've just heard about how iPS cells are made.
That's right. The iPS cell technique is a genuinely good technology. Why did it spread so widely? Put simply, even an undergraduate student can make them once you've shown them how. That was a huge strength. If it had been discovered but only one particular person could pull it off, or if it only worked once in every 100 tries, it would never have spread like this. When I first got into iPS cell research, mouse iPS cells had just been created. I went to join Professor Shinya Yamanaka's lab, and even I could do it. Professor Yamanaka actually said to me, "If even you can do it, Koji, then I feel reassured." The fact that anyone can do it is really important. So in that sense, yes, in terms of simply being able to make them, you can. But can those cells actually be transplanted? No. And there's a big gap right there. You can make research-grade iPS cells in any quantity, but making, for everyone, every single time, the kind of sterile iPS cells with the cancer risk held down to the absolute minimum that I mentioned earlier, that is an enormous undertaking. Making them while guaranteeing that quality is several levels above making them at research grade. That part is hard. We have facilities for exactly that through our company, iPS. There are regulations around it, of course, both in Japan and in the United States, and the number of companies that can manufacture in compliance with them is, even globally, quite small. As for the limits there,
those standards must be strict.
For example, ensuring sterility and confirming there are no viruses present. If, say, a person were carrying a virus and their cells were given by mistake to a patient who wasn't infected, that patient could become infected. You set out to treat the heart, but the person ends up sick from catching some other virus, virus A, instead. For research, the virus test came back negative at a research level is fine. But here you have to measure with far higher sensitivity. The kind of precision where you could run it 10,000 times and not one comes up positive. In research, you use a kind of liquid, a culture medium, to grow the cells. And that liquid can be almost anything, as long as the cells multiply. But when you're injecting into a person, in Japan at least, anything derived from animal components is hard to use. It's basically prohibited. There are times you can, but mostly you can't. So, without using animal components, what ingredients do you grow the cells with? And what quality of materials are you using? You have to work through each of these one by one. Guaranteeing that quality is extremely difficult. Another thing is that a record is kept for every single step. In research, you can just go from memory. Add 5 milliliters of liquid, draw off 2, then add some other liquid. Quickly, one after another. But when you're making a medical-grade product for human use, you check that the records are all there. Did this, did this, did this. Confirming not a single step went wrong. Establishing the process I mentioned earlier means exactly this, and it's a considerable amount of work. Something that would take about 5 minutes in research takes around 20 minutes, done carefully, step by step. And that, done one by one, is the big difference between research grade and medical grade. Even when we talk about iPS cell banking, what we're trying to guarantee is this medical grade, and the sheer volume of traceability that involves is immense. For a single person, it's this much. And when you do that for hundreds of people, it becomes a staggering amount. It's a crucial aspect of quality assurance. Incidentally, the time it takes to complete one person's iPS cells is about 6 to 8 months. Quality evaluation takes time on top of that, so there's some waiting involved. These days, the waiting list has grown longer too. Recently, it's been taking around a year. There's a wait even before production starts, and then it's 6 to 8 months from there. So if you wait until you're already ill, it won't be in time. It takes a great deal of time. In research, how long would it take? You can make them in about 2 months. But once you add quality evaluation and handle each step carefully, it still comes to about 6 to 8 months. And even that, honestly, feels fast. Anyone can do it, really. Basically, if you're healthy, anyone can. But a difficult case we ran into was someone right after chemotherapy, and who had been through chemo many times over. Chemotherapy ravages the blood cells, and that makes the iPS cells very hard to produce. We worked hard and did manage to make them, but it was very difficult, and even when they formed, the genes were damaged, so they only became cells you could hardly call a success. So what really matters is storing them while you're healthy. Or, since it's fine once some time has passed after chemo, making them once you've had chemotherapy and survived. That's also very important. But on the other hand, when people are healthy, it's hard for them to picture themselves unwell, so they don't prepare for it. That's the tricky part.
Also, as you touched on earlier, there was the news about approval from the Ministry of Health. Koji, when news like that comes out, more people are bound to take an interest in creating iPS cells, and the number of people using the service is expected to grow. So if the number of users rises even further from here,
what we're producing is at the level of a few hundred people. Up to that scale, I don't think the wait will get much longer. But beyond that, there's a chance it could. At the same time, even if you want to add manufacturing facilities, you can't expand them overnight. It's no longer like the old days, when we could only make one person's worth a year. We're past that stage now and steadily scaling up, but that's the shape of it. As for that production time, even as the science advances, it probably won't come down to a single day. A human baby takes about 9 months, 10 months, as the old saying goes, to develop. And what we're doing is essentially running that in reverse. To do it in a day, you'd have to use a completely different method. The idea that, as science advances, these will be churned out 100 times faster, I don't think that's going to happen.
and when it comes to actually making these iPS cells, making your own cells.
As I said earlier, storing your iPS cells while you're healthy means this. At any age, iPS cells can return to the state you were in at age 0. You can make them at any age. But the biggest downside is that if the DNA is damaged, then even after you reset the cell, the DNA stays damaged. That's not because of the iPS cells themselves. It's that the original cell is already damaged. So you store them as insurance while you're healthy. And as regenerative medicine advances, there will be cases where you can actually put them to use. With the funds people pay to bank their iPS cells, we then advance clinical trials that use those very cells. In our case, for instance, so that the people who've banked their cells can be helped if they ever develop cancer, we use what are called natural killer cells and transplant them into cancer patients. We're running those trials overseas, and good data is coming out. We keep producing for efforts like that, so in a sense, with your own funds, you're carving out your own future. It treats your own illness, but it also connects to treating others who develop cancer in the same way. We're a company that hopes to see medicine and science advance through that kind of healthy cycle of funding. So I think it's a benefit both to you and to others suffering from the same disease.
So it's for yourself, of course, but it also carries a strong sense of contributing to society.
Yes, for your own sake, and with a real element of social contribution as well.
And finally,
the future uses of iPS cells. In Japan, regenerative medicine and drug discovery are where the attention is. As I mentioned, in the United States, there's research on longevity using iPS cells, and data showing rejuvenation is starting to appear. Doing that inside the eye, as a treatment for glaucoma, is about to begin in the US, with the FDA approving it for use. The extracted components of iPS cells and exosomes are drawing attention too. Johns Hopkins University and others have shown they work against things like organ fibrosis. So, somewhat different applications, pointing toward longevity, are emerging. The reason is that you can obtain your own younger cells. That kind of research isn't very common in Japan yet, but overseas it's well underway, and I think that direction will keep opening up. So right now, iPS cells are mainly used to pull a state that's gone negative back to zero. In other words, you were normally healthy at zero, then you fell ill into the negative, and the medicine works to bring you back. But once this technology starts being used to keep zero at zero, or to make zero a little healthier, a whole different chapter comes into view. iPS cells have become usable for all kinds of things, and our company manufactures personal iPS cells. So if you have any questions, you're welcome to reach out through our iPS website. At the very least, it matters that people around the world first come to know that you can now make your own iPS cells. If you enjoyed this video, we'd be very grateful if you'd subscribe, give it a like, and share it. Thank you so much for watching.
Thank you.